There's a new medicine for attention deficit disorder and attention deficit hyperactive disorder. You'll need some background information. To learn about the current meds on the market, go to my lecture on the study meds by Mark Agresti, MD. In that, I go into detail about the current 6 types of medicine. There's amphetamine types, methamphetamine, dextroamphetamine, lisdexamphetamine, and the amphetamine molecule itself, which is a racemic mixture of both levoamphetamine and dextroamphetamine. The stimulants comprise of dexmethylphenidate and methylphenidate. The new drug is made by this company called ChemPharm. It's called astarys, AZSTARYS. It's a little unusual spelling, but what they've done, if they've taken the dexmethylphenidate molecule, altered it, and gotten the prodrug called serdexmethylphenidate. So let me explain further. The new drug is a combination of dexmethylphenidate and serdexmethylphenidate. 70% serdexmethylphenidate, 30% dexmethylphenidate. So what does that mean? This new prodrug, serdexmethylphenidate, is broken down, is absorbed in the GI tract, goes to the liver where it takes time to break down. And as that drug is metabolized, it is metabolized into an active component, dexmethylphenidate. So you're giving a molecule which is not active, but as it's broken down and metabolized over 13 to 16 hours, it's creating an effect by getting turned into dexmethylphenidate. So if you give a combination of dexmethylphenidate, which is 30% of the drug, in the first 3 to 4 hours, that drug has effect and helps people focus or individuals focus. When that drug wears off, the dexmethylphenidate, the serdexmethylphenidate is being metabolized into dexmethylphenidate. Follow me? So it has an immediate release component, and then it has the prodrug of dexmethylphenidate, which is metabolized in the liver into an active component, which then produces dexmethylphenidate, which lasts and has active effects for 13 to 16 hours. Sounds great. These come in capsules. They have a small dose, a medium, and a high dose. They're all 70% serdexmethylphenidate, 30% dexmethylphenidate. The drug has its effect because of what I just discussed over 13 to 16 hours. So it's a once-a-day dose, and it will slowly help you focus throughout the day. It's not all rapid onset. As that serdexmethylphenidate gets converted into the active component, dexmethylphenidate, you have active drug which helps you focus. How does this drug work? It's pretty much, everyone's familiar with serotonin selective reuptake inhibitors. This is a dopamine norepinephrine reuptake inhibitor. So it allows for more norepinephrine and dopamine to work in the system. It is similar to stimulants, central nervous system stimulants, which I talk about in my other lecture. It is in the class, I would say, of stimulants like methylphenidate, which is known as Ritalin, slow release form, Concerta. This drug is a novel molecule in that now it is the 7th type of stimulant/amphetamine on the market for the use in attention deficit and attention deficit hyperactive disorder in children 6 years and older. Side effects are very similar to the other molecules in this class. Anxiety when it wears off, trouble sleeping, decreased appetite, tics, they don't grow as much, headaches, increased sweating. There is a rare one, prolonged erection, priapism can occur with these drugs. They can increase blood pressure, they can increase heart rate, and thus increase the risk of stroke. In extremely rare instances, people with congenital cardiac malformations or congenital heart deformities shouldn't take these drugs. That's the gist of this new drug, astarys, AZSTARYS, by a company, ChemPharm. And I think I haven't used it yet. It just got its FDA clearance in the beginning of March. Should be on the market, I think, sometime in the beginning of the summer this year. It'll be real interesting. As soon as I try it, there'll be another video up telling everyone how good or bad it is. What does Dr. Agresti think? What is I'm not expecting any surprises. The molecule that's acting is dexmethylphenidate, which is like Focalin. It will be like a long-lasting Focalin. I think it'll be a very smooth drug, easy to tolerate since it slowly releases it during the day. I think it'll be a good product, but it'll be very similar to what we have. Thank you, Dr. Mark Agresti.